Hi, welcome back to your Dental Besties. I'm Ben.
I'm Claire, and welcome back to the podcast, which is all things dentistry.
And mostly not.
Mostly not. So Ben, I'm going to ask you a few, well, I'm not going to ask you questions this time. I'm going to say to you, what do you think is the most frustrating thing about being a hygienist? I'm going to go straight into it. This is the question I asked on Instagram.
Oh, big question.
Yeah.
What do I think that is the most frustrating thing? I think that we have a lot more to offer. Our education has developed a lot over the years. We're at a degree program now. The depth of knowledge that's needed is kind of right up there. I mean, we study alongside BDS.
And you'd know because tell them where you work.
Yeah, obviously I'm a tutor at the Eastman. So
Yeah.
I know what the students have to do, and I know the amount that they have to know is astronomical. And I think it's sometimes frustrating for us when we go out into practice and we're waiting for a prescription for LA. They've done modules on it. They've done exams on what constituents are. Or, I don't know, they want to see a direct access patient, but we're in the smallest room in the practice without any kind of radiography equipment or like these types of things. I just think it's hard. I think it's hard. And we often fight to get on the course because it's so competitive. We fight throughout the course because we want to stay on and we want to do the best we can, and we graduate and we're still fighting for respect within the profession, fighting for kind of, I don't know, decent working conditions, equipment. Like, it constantly seems to be a struggle. And I know I've heard hygienists say, my dentist's just bought an iTero scanner, but they'll not update my hand scalers. Like that, I think, can be really frustrating, and it's disheartening.
It is. I think as well, because dentists don't do as much about our like niche area of dentistry at university, there's not as much. I mean, I'm not speaking for all dentists. Some of them do value what we do.
Yeah, obviously, there's always going to be the exception.
But I think a lot don't value necessarily what we do because they don't do as much of that when they're doing their course. So it's like left to us, we're the experts in it. But that almost makes it feel like we're always having to battle because, you know, and in terms of bringing the money into the practice, I know I'm not bringing in Invisalign prices. I'm not bringing in composite bonding cases. You know, it's although some therapists are now, which is absolutely fantastic for therapists.
Really good.
Really, really good for therapists. I think things are changing.
Definitely. When did I graduate? 2011. And it's a different field out there now. And again, like we said on the last episode, it is a really exciting time to be a hygienist or a therapist. Thankfully, we're going to have kind of the exemptions with the prescribing. So that's
people are at least listening now.
Yeah, listening. And we are integral part of the dental workforce. So
if I get to my deathbed and I've been a contributing factor in change in terms of people see our role as we become the cornerstone of a practice, I'll have done well in life, I feel. I'm like, so that's when I get to my deathbed.
I've got images of Rose in Titanic being on her deathbed, being like, it's been 87 years, but I've finally done it.
We're a cornerstone.
As you take your dentures out.
Yeah. I didn't listen to my own advice. Like, if you listen to our Lost podcast, do as I say, not as I do.
Yeah, absolutely.
I ate all those quality streets.
Toffees.
So on my Instagram, as you know, I put out like some call-ins to like ask a few questions, get people to answer in, and then we're going to talk about it on the podcast. So I actually, what the question I put to you about the most frustrating thing about being a hygienist, I put that out there on my Instagram. Yeah. And here are some of the things people said. Okay. Neck pain is a frustration.
Oh my God, my neck is so sore.
Neck, shoulders, back.
Yeah, it's across my arm. But when you think about it, we've got like I'll luckily only work one long shift a week. I'm quite fortunate because obviously I'm doing loads of other stuff. But I've got my left arm up, and I thought, why is it hurting so much? And I lifted my arm, and I thought, I've had it like that for 11 hours. No wonder it hurts. Yeah. It's like doing yoga for 11 hours. Obviously you're going to ache, but yeah.
And I think when you're in dental school as well, and they're always like, watch your posture. I remember just being like, I was 21. I ain't watching my back. I'm invincible until I hit 35. Yeah. And then I hit 35 in the last 3 years. I'm like, oh, I get it. I get why we had to watch our posture. Yeah. The chiropractor is making a fortune out of me.
Musculoskeletal problems in kind of dentistry is just...
It's a thing. is the thing. And you've got to look after, I mean, if you're listening to this and you're in your early 20s and you're starting off your career in dentistry, you don't have to be a hygienist therapist, like if you're a dentist as well. If you're starting off your career in dental nurses even, oh God, they must suffer too. If you are starting off your career in dentistry, genuinely, don't just ignore this advice. Watch your back.
Do Pilates.
Do Pilates. Do yoga, do Pilates. It's a thing. So just to digress, you know those like videos you see on social media, and it's about and it's like the jokey ones about the chiropractor.
I've seen the skeleton one.
Yeah.
He snaps the
Where he
legs
snaps
back.
like that is exact. Have you ever had a chiropractor appointment?
Yeah, it creeps me out when they do the neck crack thing there.
Well, so I laid there, and my chiropractor, shout out Luke Rivers, he's great. So he's my chiropractor. So I was laid on the bed, and he was like, you know, are you happy for me to do some treatment? And I was like, yeah, because that's what I'm paying you for. And I wasn't, but I didn't realize he was preparing me, because he literally it was like a bit of a head massage, and then the noise that it made.
Creeps me out.
I started laughing. I laughed so hard that I was crying. He was laughing because he was laughing at me laughing. So I was like, does everyone act like this on the first time? And he was like, no. Just to sort of let you know, as we walked out, my hair's all over the place because I've been thrown around, having my back cracked, my neck cracked, whatever. I've got mascara down my face because I've been crying from laughing, because I was like, the memes are real. It is like that. He's a bit disheveled because obviously it is quite hands-on, isn't it?
Yeah.
I'd have to, why they're not wearing sports equipment, I don't know, because they're having to pull you around. We came out of there looking so disheveled. I bet everyone was and then I'm screaming with laughter. People must have been like, what is going on in that? Anyway, yeah, it's, you definitely look after your back, otherwise you end up paying a chiropractor a lot of money.
Speaking of sports equipment, have you got figs on?
Of course. I live in figs. I thought you wouldn't notice. Yeah.
Claire is obsessed with figs. It's hilarious.
How
Okay.
I'm not an ambassador, I do not know.
No, me
I'm wearing
neither.
them to become one. I just want free
Yeah,
figs.
You'll be buried in figs.
I don't want to be buried in figs. Actually, I don't know if this is a little bit of value for people listening. Skrubz, spelled Skrubz. Have you heard of them?
No, but you said they're really good.
I like them. I'll be honest with you. I'm hiding. Some of the lining of these are fraying a bit. The Skrubz ones wear really, really well, and they're a little bit stretchier, so they're a lot more comfortable. Oh. Yeah. I'm a big fan of the Skrubz ones.
I thought about getting some. I saw them at the dental show. I really want burgundy ones.
Yeah, they're nice, and they're a fraction of the price. It sounds like an ad. This is not an ad. I do not work with Skrubz, but I just think
it's
we
good
wear
to
them.
know.
Yeah.
Everyone talks about what's Skrubz, and I think they're quite a new company, aren't they?
They're quite a new company, and they're obviously UK as well. I've got a feeling that they're in the dental industry when they created Skrubz. I don't know anything about I don't really know about the founders. I feel like they might have been dental, but it's UK based, and obviously that's cheaper anyway because the shipping.
Yeah, shipping. Oh my God.
Shipping with figs.
So
I do love
expensive.
figs. So if they are listening, send me free figs. No, genuinely, for everyone that's listening, Skrubz, I have been really impressed with them. Spelled Skrubz. But like I say, this isn't an ad. Let's move on to the next one. Lack of nurse.
No way. It's 2024.
How have we not got nurses?
Yeah, we should not be working without a nurse.
Yeah, I mean, chaperone for one.
Yeah.
I've had something scary happen to me. I say scary. It was shocking. So it turned out mental health was implicated as well. So that's why this happened. And I don't want to go into too many details, but exposure. And I had a nurse, but had I not, do you know what I mean? It's things can happen in a surgery when you're on your own.
Surgery by yourself. Something might not happen, but it's then your word against theirs, and also just general work like aspiration, pocket chart.
Yeah, I mean, if your back's bad with a nurse, it's going to be. Yeah.
It's hard being by yourself all day.
Yeah.
We have conversations, but we have the normal conversations. How you doing? How's your whole day? How are the kids? If you're doing that 15 times a day, you don't actually have any proper conversation.
Yeah.
Oh my God.
Oh my gosh. Can you imagine doing 20, 30-minute appointments? No, not even
We've done it before. We can't sit here and say, I'll never do it. We have done it before ourselves, but no, not now.
No, especially not with the essays we have to write after treating a patient, literally the notes. So the essays we have to write, the conversations we have to have. So, I mean, just to go through, we have to have conversations sometimes about people losing their teeth. That, for me, that's a functioning body part.
Yeah.
So to tell someone you are literally heading down a route of losing a functioning body part, that, we need to stabilize, that conversation takes time. Now, you could be hit with an emotion like, I don't know, someone could be angry, or they could, why have I not been told this before? Or sad, like, that's upsetting. Yeah. And so we have to deal with that emotion, looking at the clock thinking I could do without this, like, because I've only got 20 minutes to do all of that as well without a nurse. No, decon, clean down, You're having to compromise.
There's a compromise somewhere.
Yeah. And then mental health wise, as we said before in the last episode, as hygienists, we do our job. I mean, dentistry, we all do our job well. Like that's how we do it, right? But, we want to reach a standard, and to have to compromise, it's not good for your mental health.
No, not at all. No. I don't.
And it's also not good. One. It's just not good.
No.
There's no compromise.
It's just not good.
Oil pulling. What's your thoughts?
What the hell?
Is that frustrating?
Oil pulling? That was like 2017, wasn't it?
I actually had a patient asking me about it yesterday.
No. It was really common. And I will say, we had a nurse at the practice who thought, I'm going to trial it out. And her teeth genuinely did look whiter after doing it. But she'd do it for like 30 minutes a day, every day. Coconut oil. And I was like, what's the point?
How did she not swallow? Yeah. I'm like, nope, it's gone. 3 seconds.
It's hard. No. I
tried it and I gave it a go to sort of, I wasn't opposed to the feel of it. I quite like coconut, and it feels dead slippy after, but it's going to, because you've got a mouthful of oil. But I mean, yeah.
Is there any evidence?
No.
Okay, then.
Yeah. I mean, I've never told a patient to do it. Well, this patient asked me yesterday and they said, oil pulling, is that a thing? I was like, don't do it. No, you just need to use the teeth. Stop trying to get out of using the teeth, please. Why would they have something in their mouth for 30 minutes to avoid doing something for 3 seconds?
I know. It makes no sense.
It makes no sense. Frustrating thing about being a hyge, open a little wider. I think what they must have meant by that is the mouth constantly closing. Optragate. I have one word for you. Optragate.
Do you know what though? I like Optragate. It's not for everyone, and I certainly find older patients struggle a lot with like it rubbing on their frenum.
Oh, if they've got a low frenum, yeah,
100%. But also, I just think I give them a little break. I mean, how often do we walk around with our mouth open for 30 minutes? Mm-hmm. And we've both had hygiene appointments. After about 8 minutes, I'm like, oh my God, my jaw is killing.
Yeah. It's true, and patients do struggle. I always make a joke and say, like, it's amazing how hard it is to keep your mouth open for a long period of time, because it does get tiring.
Yeah, it gets really tiring.
I give them a little masseter massage.
Yeah, just to help. Or I do quadrant break.
Yeah.
And then it's only a few seconds, but I just get them to bite up and down.
Yeah.
And then we'll go on to the next bit.
I think the Optragate does help them, so they don't, if they are starting to close, it does keep them open to a certain extent. I think.
Soft tissues, it's brilliant. I've got some patients that I use a little bite block for.
Okay.
Just really struggle.
I've not seen a bite block in a few years.
I know.
Oh, a bite block.
Well, I really struggle even to get the aspirator in, and I just thought it's much more comfortable. Patients really like it. So
could you get a bite block that also aspirates?
Well, you can get a bite block.
Have I just thought I invented something and it's already there? Oh, sugar.
And they've got like 2 little ledges on the outside, so you can stick a saliva ejector.
I thought I just invented something. I thought that was my millions made then.
Sadly
God
not, no.
damn it.
Podcasts for you.
Stick to podcasts. So most frustrating thing about being a hygienist, very little promotion options with nowhere to go. I think that's actually on our list of things to talk about.
That is very true. That is very true. I think again, correct me if I'm wrong, but if you do BDS and then you work in the NHS and you do a master's, you could become a consultant in dental public health. If we do master's in dental public health, we're just a hygienist.
That's actually the next one.
A master's in public health. So I think it's a case of not really understanding our role, what we're capable of doing, the level of education. But again, things are changing. I'm not being pessimistic about it, because I do think that things will change. We do have a lot to offer, so watch this space.
Yeah, I feel, so I was in the army, as you know, before I came out of the army. I was a hygienist in the army, and obviously in the army, you have got promotional prospects, because you're like, what do I need to do to become, like, I was a corporal, what do we need to do to become a sergeant? What do I need to do to become a staff sergeant? I really wanted to be a warrant officer. I wanted to be head of the hygiene school. Then it all got disbanded. So it was never going to happen. God damn it. Nope. But I had that career aspiration. And then when I got out of the army, I was like, there's no promotion. And that did not sit well with me because I'm like, I have to be working towards something. Like we said in the last one, like growth is an important thing for everyone, but it's a very important thing. Being stagnant for me is a real, can't do it. Yeah, not good for me. So I thought, right, well, I'm going to have to make this work myself. So I feel like I've created my own promotions. I feel like as I grow and change and my career takes off in a different trajectory, and that's happened like numerous times, I'm probably pretty good at making things happen. I think experience has taught me that I can do anything I put my mind to. So imposter syndrome doesn't really hold me back so much, I guess. So I feel like I've created my own promotions. It depends what you define as a promotion, like you just said.
But then I think I agree with you. You kind of create what you want and just manifest, and kind of people don't know what they don't know. And
yes.
I think it's like, okay, I've been in practice. I've got loads of experience, but how do I, and we see it all the time, I want to be a tutor, but how do I become a tutor?
Yeah.
I'd love to work with brands, but how do I do it? How? And it's stuff we're obviously not taught, and it's kind of self-learning, which then goes back to the whole you create it yourself.
Yeah.
But it's difficult to kind of get out of that mindset of Monday to Friday, 9 till 5.
Yeah.
Where am I going with this?
Especially when it wears you out and it's tiring because you're working 20 minutes without a nurse.
Yep.
And you're like, I hate it. I don't want to do more of it.
Yeah. But you don't hate it. You love it. But you hate the circumstance that you're in at the moment.
That's something that's really, really important to define. Like, you don't hate, because we have a fantastic career. You don't hate it. You hate the circumstances you're in. Because if you can change those circumstances, if you've got the ability to, I guess, or if you've got the I don't know, what's the word I'm looking for? The fight to, because it is like, sometimes you might have to speculate to accumulate, and that's scary. So if you can face that fear and then, create what you want, and you're willing to like work hard for that, then I think you could love what you do. Interesting. I love that. We'll talk about that later. I think that's a really good topic to discuss. So you've already touched on this, but being called just a hygienist is so frustrating, isn't it? Not just a hygiene. I'm an oral health expert, actually. What are you an expert in? I ain't just a hygienist.
Just
baby.
a hygienist. I can see where it comes from.
Yeah.
Because a lot of us do it to ourselves. And
because you've got therapy hygiene, I'm not both. I'm just a hygienist.
I'm a therapist. You're a hygienist.
Yes.
And you would say, I'm just a hygienist because that person is there, something else.
Yeah.
But, I mean, no one says I'm just a nurse or I'm just a therapist. I think it's a confidence thing as well.
100%.
Dentistry for a long time has been hierarchical. So the dentist's at the top, and then you've got everyone else beneath them. And I think, obviously, direct access, we can open up our own practices now. It's slowly starting to change, but it's always a case of kind of dentist says jump, we ask how high, and I'm just a hygienist, like I can't challenge a dentist. But you can't. It's not challenging, but you might bring different perspective to it. And that dentist might really value what you say. But so I think a lot of it is to do with confidence.
Yeah. I think things changed for me when I started seeing myself as a business. So I was like, I'm self-employed. Okay, I can invest in myself. I can invest in my business. So I started making investments. I was like, well, this is how I want to treat my patients. So this is what I'm going to buy in order to be able to treat my patients that way. So then when I approached companies, because I would approach them. So I think every practice I've worked for post-army, I've approached them. I've not gone to an advertisement. I've approached them with a proposal, a business proposal. This is what I have, this is what I do, this is what I want to charge, this is what, and so I've gone in as like a business person talking to a business person, and we could work together.
That's such an important point. I say this all the time. We are our own business. We are self-employed. So it's really important that we kind of treat it like a business. And doing the proposals, you kind of a director of your own company.
Yeah.
So you are your one employee that you need to look after. So you need to invest in yourself. It's getting out of that mindset and thinking, I'm just going to work and I'm just going to do my scale and polishes like all day, because the dentist is going to benefit from it, or the practice will benefit from it.
And I think that's what made me feel like I wasn't just a hygienist.
Yeah, no one's just anything.
No one's just... And I had a patient actually say to me once, I went, oh, so what do you do for a living then? Getting to know them. And she was like, oh, I'm just a waitress. oh, it sounds like Friends, doesn't it? I'm just a waitress. And I was like, no one is just anything, because if you weren't just a waitress, then I wouldn't be just getting my dinner. I wouldn't be just getting my coffee. I was like, you are needed. No one's just anything.
Yeah, exactly.
Everything's necessary. So no one's just anything anyway. So most frustrating thing about being a hygienist, not being appreciated for the skills that we bring.
Yeah.
That leads on to that a little bit. We just spoke about that, really.
We spoke about that, but it's the same.
Yeah.
Like, we're trained to a high level. And I mean, what my students know, dear me, it's a lot.
Yeah.
And then they go out and it's maybe not listened to or not valued, or they haven't got an avenue to kind of, or a stage or a platform to actually say, like, this is how much I know.
Yeah.
Just put into a surgery and just do what I'm paying you for. With that.
That's what's really great about like big names making big changes, you know, like, changing things for therapists, and people are really stuff like, oh, unfortunately, I think when we are talking to business people, so practice owners are business owners, the conversation changes when you talk about it from a business perspective, because it has to be good for business, right?
Yeah.
And I think people are finding ways to make it good for business, and so those conversations are starting to change. And I think there's big names in our industry that are making big changes and paving the way. And I think at some point, like we keep saying, we're trying to be really optimistic. We are starting to become appreciated for the skills we bring.
100%. I think we are. And I think it's just going to be a matter of time, a few more years, and we'll really start seeing even more changes when we'll look back.
Yeah. So the person that wrote that one in, wait out. It will.
Wait it out. It'll get better.
If
not, reach out. We'll chat.
Yeah, we'll chat. We're besties. Yeah, FTAs. How do you stop an FTA? Charge them a blinking holding fee for the appointment.
I'm quite lucky. I've been in my practice a long time. I don't really get a lot of FTAs. Reception are on it. So if anyone cancels, then reception are on it. Cancellation lists, that really helps.
Yeah.
There are times when I'm like praying I'll get an FTA.
Please, I want a coffee.
Yeah, I really want that.
I need a lunchtime today.
But and you don't get one. If it's a patient that's always constantly late, I have had conversations with patients and been like, look, I'll do what I can in this appointment, but I have to finish at this time because my next patient's going to be waiting and it's not fair.
Yeah.
And they're a bit taken aback. Well, I'm paying for the full time. Yes, but we're already in that full time.
Yeah.
And that's changed a few. So they're coming now on time.
Yeah.
It depends. I think case by case. Some patients genuinely just forget. Am I going to charge them because they've forgotten? No, I don't think so. If they're going to rebook, fine. I don't want to spoil that relationship. And money's like tight for a lot of people. I mean, just drop 60 quid on an appointment that you genuinely did forget, or you were stuck in traffic. Fine.
Do I do it again next time? I'm joking.
Well, yeah, and they're usually really apologetic, and because I've not charged them, they're like, okay, you're not just out for
so you have
money.
like a grace, like once grace, and then if they're doing it 3 times, you surely charge them at the 3rd time.
No, if they do it once, then grace. Yeah, if they do it twice, then I'll make sure that they have to pay for the appointment next time.
Yeah. So we call it a holding fee because patients actually don't like the word deposit. Have you noticed that?
Really good term. I like it.
Yeah, holding fee. And the reason for that is, so like we spoke about in the previous podcast, my books, until I recently left, my books were full until December. I was working like 4 or 5 days a week. It's just, and there was just me.
Yeah,
and so our waiting list was huge. And so what we noticed was a £35 holding fee was enough that a patient was okay with losing that. This is what we've learned over the years, whilst we were like adapting to make sure that everything was really effective and efficient. So someone is willing to lose £35, clearly, because they'd pay it, they wouldn't turn up, and it's like, oh, I'll just rebook. I mean, great, we got a little something. But we were like, okay, let's up the holding fee to like 50. 50 seemed to be quite a good threshold, that it wasn't break the bank as a holding fee, but it was break a bank enough that they wouldn't miss the appointment.
50 quid.
Yeah. So, and we were quite strict with it. And so we just didn't have white space. And then because we had demand, because we had this really long waiting list, people would be like, I mean, so I genuinely had a long waiting list and I was fully booked until December, but you could say that you are like, so this is a bit of advice for people that are trying to grow their book, I guess. If you increase your demand, so you're, we're so fully booked for ages, but you know, we've either got an appointment next Wednesday or we could put you on a waiting list and then we'll call you as and when anything comes up. But we'll book you into. Patients usually go, okay, put me in next Wednesday. And then, okay, we'll have to have a holding fee for that because as you can see, there's a lot of demand. Okay, we'll put a holding fee on that. It really does help to fill those spaces.
I've started booking my own appointments.
I've started doing the same. Dentally is good for that. Do you have dentally?
No.
Oh, what do
you? Just do it in surgery.
Oh, okay.
Patients like it. I'm like, get your diary out. We'll sit down. We'll find an appointment. And I do the same thing. Like, I am really busy, but I could get you in here.
Yes. So it's like you're the one that's like, yeah. I like that. Yeah. I like that. The door opening. Someone said it's frustrating. I know who wrote this in. You're not even laughing. It was you. You replied. You're like, the door opening. That's frustrating.
No, do you know what is a pet peeve?
You must have had a bad day that day.
Is when people just walk into my surgery.
Oh, is that what you meant?
When I was a nurse, we were always taught you knock.
Okay.
You wait, you enter and say, sorry for disturbing you. Out of respect for the patient, is it okay if I get whatever out? Because we all forget stuff in the surgeries. It really annoys me when people come into my surgery, don't say anything, just open up the drawers, and I'm treating the patient, because I think that is a very personal and private appointment, and the patients are in a vulnerable position to not know what's going on.
Yeah.
And again, it's like that service, isn't it, really? Like, if you're in a hotel room, you paid a lot of money for the hotel room, and then the cleaner just walks in, starts cleaning the room, and you're still in there, and then leaves, you're like, what on earth just happened?
Yeah. And patients are laid there as well, at mouth akimbo. Mouth akimbo. And like, what's going on? Like, sometimes you do see their eyes as well. They're a bit like, who's just like...
Yeah, what's going on?
Yeah. And especially if it's a high-stress environment for most patients. So it's not good to just have the door open, close. No, you're right. I see what you mean by sending that. I thought you were being like... sort of facetious.
No.
The door opening. I just don't like patients coming in my surgery. Full stop.
No.
I thought we had a bad day. I didn't follow that up either and ask you about it. Sorry, that was such a bad bestie thing. I didn't ask if you were okay, but clearly you were. So people who say they floss, but do you though? But
well, they might just not be doing it right, and that's our job to coach them through it.
Yeah.
People go to the gym, they might not lift weights right, so that's why you get a personal trainer.
Yeah. We're personal trainers.
Yeah.
I like that. I'm like, now my brain's like wired thinking, how do I make that into something? God, I'm such a different breed, aren't I? Business opportunity. Electric toothbrush doesn't clean as... okay, so I think this one means when patients say, I don't use an electric toothbrush because it doesn't clean as well as my manual toothbrush.
Yeah, it's psychological, isn't it, really? Yeah. So if you're scrubbing away, you can hear it, you can feel it. It's quite aggressive on the teeth. So in their head, that...
and then physical
movement. Okay, well, you can clean your car by hand, or you can take it to... I call them the hairy monsters. Do you know what I mean? Like the ones in the garage. Yeah. Or you can take it to the one in the garage.
You can take it to a hairy monster.
The hairy monster will take you 5 minutes.
Yeah.
And you might get like a 90% clean. Yeah. But in 5 minutes, how much of a clean are you going to get by hand?
Yeah.
It's the same thing.
Yeah, it's going to get a lot further, a lot faster.
Yeah.
I always say to my patients as well, there are thousands of studies that actually look at what you're saying, manual versus electric, and no study says a manual's any good. And then I always like try and chip in with like, I've been a hygienist for 15 years. And in that 15 years, I'd probably say like a handful, maybe not even like 5 patients have got it like absolutely spot on without causing damage and getting rid of everything.
There are a few that are really good with a manual toothbrush. And I'm just like, yeah, you do you. I'm like, I'm fine with that. There's no recession. And they genuinely just prefer a manual. Fine.
But it's few and far between because it takes a lot of time, skill and effort to get it right. And what are the usual reasons people opt for a manual over electric? They have less time. Yeah. And they have there's less need for skill or whatever. So I always like, if you're going to put the time, the skill, the effort in to not cause damage, but still get rid of all the biofilm, you'll be there for like, we say 2 to 3 minutes for brushing, but to get it right with a manual, you're looking at like 10 to 15. And I always say to them as well, I'm a hygienist and I know I definitely do better with an electric over a manual. And I know exactly how to use a manual.
I'm terrible with a manual toothbrush.
I'm terrible.
I find it so boring.
I can't remember the last time I did it.
Usually on holiday.
No, I take my electric. Don't you have a charging travel case?
Not charging one.
Yeah. Oh God, you need to
I've
work
got
more of it.
a case.
You've got an abundance of mouthwash.
I'll tell you what I do take on holiday. I don't know if you've heard of them. A Surrey toothbrush.
Right. So you think I'm going to use a Surrey toothbrush? I have heard of them though. Tell me.
Or a Bay Queen.
Yeah.
They're just really good. They're really sustainable. So you can change the batteries in them. You can recycle the head. It's more like a sonic toothbrush, but you can charge it with like your iPad cable.
Okay. No, I will always be an IO girl.
I've got an IO at home. I do use IO every day. But yeah, the Surrey toothbrush, I'm quite impressed.
Do you use the test drive?
In a patient?
Yeah.
Yeah.
Best thing, one of the best things.
Bring your IO with you. We'll use the head on it next time.
Yeah.
And then you can get a new head.
And that's a good idea. And you can see what the head standard is.
Well, that's what I want to see. You pull it off and the black mold comes out.
Oh. When the patient's like, I've had that on for like 2 years. Right, I'm going to do, because we're like nearly at the end of this podcast, I'm going to do an agony aunt or uncle now.
Okay, hit me with it.
I'm just going to pick one randomly. So I don't even know what this is going to be. Because we're running out of time. So, okay. What length of time should it take for PMPR each pocket of perio patients? The practice has changed to a standard 30-minute appointments, which I've said is not long enough when you have a patient with pockets on every tooth. We can't treat everyone the same. That's true, we can't.
Just answered their own question.
Yeah.
You can't possibly. Like, if you have 5 heart surgeries, you can't be like, right, you're going to have 2 hours for each one. One might be more complicated, one might be less complicated. Like,
I love these analogies. True.
But it's true.
It is.
And you wouldn't say to a dentist, okay, you've got an occlusal, so here's 20 minutes for every occlusal.
You have to take every tooth out in 10 minutes. I don't care if it's an 8
Yeah, exactly.
or if it's a whatever.
This is madness. And I think it just comes back to communication with principals and the other dentists. Like,
yeah, it comes down to that whole scale and polish mentality. That's all we're doing. And when they don't understand what we're doing. So do you think there needs to be like an element of hygienists saying, look, can I do some in-house training with everyone so you can actually learn what I'm doing? So maybe you can teach me about that and I'll teach you about what I do. And then you'll see why 30 minutes isn't good enough.
Come in my surgery for half an hour and see what I do.
Yeah. Yeah, if you had like one pocket to treat and on a really well-maintained patient, 30 minutes is fine.
Well, yeah.
But that's like a well-maintained patient with one pocket. If you've got like every single site on every single tooth to treat, you're looking at like 3, 4. I don't do quadrant by quadrant anymore. I do like 3 and I work that way. So I go sort of around. So I go around and then finish off. Is that weird?
Start worst site. I might do, again, it's all bespoke care. That's what we should be doing.
But that's the thing.
Anyway.
Some people it's 2, some people it's 1, some people it's 4, some people it's 3. Like you say, it needs to be bespoke to the patient. It could be generalized, it could be, I suppose, intermediate, or it could be localized. And so it is going to be different every single time. We should be given the autonomy to just make that decision.
It's our name that's going on the treatment. We're the ones doing the treatment. So I think it's up to us to decide, surely, how long we have.
Yeah. 100%. We wouldn't tell a dentist how to work, so don't tell us. No, oh, we shouldn't. We're not bashing.
We're not bashing dentists.
We're not bashing dentists.
But I do think there's a common kind of misunderstanding of what
there's
we do.
A battle. There's a common battle we see, and we see it on the forum all the time when we go into, because we do a lot of lecturing, we do a lot of going into practices. There is a common theme, and so it's our mission to change it. So hold your deathbed, change it. I'll be there going, I made changes. Now it's 45 minutes.
Be an hour by the time you go.
Better be an hour.
Yeah, we need it.
Oh, well, that wraps us up then. Another episode done. God, they fly by. How are we going to wrap these up? I feel like we're in the same predicament as last time. What do we say now?
Thank you for listening. No, thank you for listening. And obviously, if you've got any questions, then you can give us a like or a share or just comment on our Instagram page. We're here for you, and I hope you've enjoyed being a little fly on the wall in our conversations.
You are a fly on the wall. And also send us in your questions, because we want to be able to answer them specific to you. We can keep them anonymous, or you can get a shout out. It's entirely up to you. But like, subscribe, comment, share. The bigger we get, the more we can bring to you and help and just chat and do more of this.
Bye.
Bye.